Okay guys, before we will start talk about disease, we need to remember a normal vessels system. And you know that we have venous system and arterial system, yes? And they started from heart. Yeah? It's schematic. Picture of heart. And we will start talking from venous system. From venous system. You know that blood, I take this part like blood. The blood coming to the heart from vena cava, superior and inferior, yeah? Yeah?
Yes.
Yes. This is our blood coming to the right atrium. Then it go to
Right ventricle.
right ventricle. And what is this?
Tricuspid
What?
valve. Tricuspid valve.
Tricuspidal valve. Okay. And then it go out. How?
Pulmonary vein.
Pulmonary artery. Yes. Of course you understand that it's not a real picture, yeah? Just a schematic. Then it go to
Lungs.
lungs. And there we know that we will have an arterial blood. Yeah? Yes. And where it go?
Left atrium.
To the left atrium. Okay, it go to left atrium and then
Left ventricle.
to the left
ventricle.
ventricle. From what?
Mitral valve. Bicuspid.
Yes? Okay, and it coming to left ventricle and then
Aorta.
out where?
To the systemic circulation.
How we call this vessel?
Aorta.
Aorta. Yeah. Go to aorta, yes? And there we have a small ductus, yeah? Between aorta and pulmonary artery.
Arteriosus.
How you call it?
Ductus arteriosus.
Ductus arteriosus, yeah?
Yes.
And we called it Batalov ductus, yes?
Yes.
Batalov ductus. In normal, it is closed, yeah?
Yes.
Okay. Then our blood go to organs, yeah? For example, heifer. Yes? Absolutely all organs. And there we can say bye-bye for oxygen. Yes? And it started a venous blood. Yeah?
Yes.
Or no?
Yes.
Yes. Okay. We know that from organs, venous blood can go with two-way. Two-way. First way,
Artery.
vena cava
Yeah.
system, yes. And second way,
Anastomosis. Cava cava.
Cava cava. Porta cava.
vena porta,
Yes.
yes. Two system. And what different between these two systems?
Vena cava goes the blood from the vena cava directly goes to the right atrium, and whereas the blood in the portal vein goes to the liver and then to the
Yes,
vena
vena cava take blood from organs and go direct to heart, yes.
Yeah.
Vena porta take blood from organs and go to
Liver.
liver. Why vena porta go to liver?
They have the blood in the vena porta. It may have nutrients.
Blood have toxins, yes. Blood in vena porta system have toxins because she take blood from organs like a gastrointestinal tract, yes, and all these blood have toxins. In liver we have filtration of this blood, yeah? And then, if you know, this is vena cava inferior, yeah? And from Hepar we have a vena,
Hepatic vein.
Hepatic.
yes, hepatic vein. What coming to vena cava, yes,
Inferior.
inferior, yes, and then it go to the right
Artery.
atrium. Yes, you're right, great. And now, when we know these two big round of circulation, we can remember in third round. What is the third round? Third. We called third round a system what circulate in heart. Yes, you know that heart need to have oxygen. Yes, and how it can take oxygen from what? Where?
Aorta.
When?
From when the blood goes from the left ventricle to aorta.
To aorta and
So there are branches of aorta to the supplying to the heart directly.
okay. This is aorta. This is aorta, and this is left ventricle. Yes, and when we have a
Contraction.
systole, yes, or contraction, blood go to the
Aorta.
aorta. Yes,
And at the beginning with the small branch.
and there opened a
Valve.
Aortic.
aorta valve. Yeah,
Yes.
and look, artery, coronary artery are there. Yes,
Yeah.
and when we have systole, valves close coronary artery. Yes, but when we have
Relaxation.
yes, our walls will close the ventricle, yes, and some blood go down, yes, some blood go to all organs, and some part go down to the coronary artery. Yes?
Yeah.
That's right. Okay. And now when we know about this system, I want to ask you, if we have tromb of, you see, yeah?
Yeah.
If we have tromb of, for example, left leg, or right leg, maybe, and it goes away, yes, to vena cava, and come into heart, it can come into brain, or no, to brain vessels.
Probably.
Probably. What do you mean?
Maybe. Maybe.
Maybe. Let's come in and show me how.
No, she says probably means it may maybe.
Yes, I understand. What about your thinking?
If it is small enough to pass through the walls, it may go from the aorta to the brain.
Look. This is our tromb. Yeah? And he go to the heart. And coming to the right atrium. Yes? Then it go to right ventricle. And then it go to lungs. Yes? And in lungs, we know that we have a small, really small. So small that they are really very small vessels. And it is a big tromb, yeah? Vessels in lung is like this line. And tromb is bigger. Yes? He will stay in lungs. How we called this pathology? Pulmonary embolia. Yes? Thromboembolia of lung arteries. Yes? Or thromboembolia of pulmonary arteries.
Pulmonary artery.
Pulmonary artery. Thromboembolia of pulmonary arteries. Yes? Yes, it can happen if we have some thrombosis in, for example, legs vessel. Yes? Okay. And what we will have? No, not we will have. How we can have a thrombosis of brain arteries? Three variants of this problem. I remember you that brain arteries, this is aorta, yes? And from aorta we have some vessels.
It may pass through.
Subclavia, yes? Bronchoceliacus, yes?
Bronchus.
Yes.
Brachiocephalic.
And truncus
Common
Common
carotid.
carotid.
yes. And you know that from this and from this vessel we need have tromb to have a thrombosis of brain arteries, yes? There we will have a brain. And maybe you need some time to understand how we have a thrombosis, or I will explain. Okay. Three variants of this pathology. First variant, second variant, and third variant.
Oh, septal defect.
Yes, defect of
Septum.
Atrium.
Atrial septum.
Interatrial septum defect.
yes, defect of
Interventricular septum.
interventricular septum and
Ductus arteriosus.
opened ductus arteries.
Arteries.
Yes. Three variants when your tromb can go there. But he have some problem. If patients have a defect, yes, we know that pressure in this part less than pressure in this part. Yes? And look, how tromb, what, for example, there is normal situation, no problem, no pathology, yes, normal pressure, it's comfortable condition for him. How he can come in to the left atrium where is non-normal condition?
When there is pathologically increased pressure in the right.
Yes, just when we have a pathologic increased of right part of heart, yes?
Yes.
When we can have the pathologic increased of right part.
Hypertrophy.
Stenosis of
Stenosis
Yeah.
of pulmonary artery. Yes. If we have stenosis, not all blood go away. Yes, and it will stay there.
Yeah.
And if this blood stays there, not all blood can come in there. Yes, and it lead to increased pressure in this part and tromb like go there. Yes, just in this situation.